In this video, we will demonstrate for you how to properly operate the ANS analysis. In order to perform a measurement, attach the chest strap to the patient and ask them to have a seat. Pressing the plus sign will allow you to add a new patient. The fields marked green require mandatory data entry. You are also given the option to add an email address to forward the measurement results to the patient after the analysis. Once all of the information is entered correctly, press Done and a new window for the measurement will open up. The measurement time for a standard measurement is preset to 520 RR intervals. As soon as the connection between the heart rate monitor and the ANS analysis is made, the RR intervals are registered. You can now start the measurement. Position the iPad so that the patient is not able to see the recording. Generally, the patient is to be left alone during the measurement. The individual RR intervals are recorded and visualized in the rhythmogram. The lower graph shows the activity of the parasympathetic nervous system in real time. The ANS analysis ends automatically with a recording of 520 RR intervals and will save the measurement as well as date and time. The first report illustrates the recording of the heart rate variability by means of the rhythmogram, the histogram, and the scatter plot. Sliding to the left on the iPad will access the patient view, which illustrates the heart rate in purple, the sympathetic index in red, and the parasympathetic index in blue. With a tap of your finger, you can switch between patient and practitioner view. In practitioner view, there are two additional parameters: the risk parameter alpha 1 in green and the overall variability in orange. In case of an imbalance of sympathetic and parasympathetic activity, a second measurement under a specified guided respiration is recommended in order to reveal the parasympathetic reserves. Start a new measurement and activate the guided respiration. The setting of the guided respiration is preset to 6 respiratory cycles per minute. In order to respond to the individual demands of the patient, there are further respiratory rhythms available, which range from 4 to 10 cycles per minute. The default measurement time is preset to 130 RR intervals. Instruct the patient to follow the respiratory rhythm. Optionally, you can enable auditory guidance of the respiratory rhythm.
And breathe out. Breathe in.
Once the patient is able to follow this rhythm without any problems, the measurement can be started. For full concentration on the respiratory rhythm, activate the I symbol to hide the HRV recording. Now only the progress and the respiratory guidance is visible. Generally, the patient should be left alone during the measurement. Ideally, the heart rate variability should adapt to the respiration. With sufficient parasympathetic reserves, a clearly visible respiratory sinus arrhythmia will occur. To assess and discuss the measurements with the patient, these two results can be compared with each other. Ideally, the second measurement should reveal a reduction of the sympathetic activity and an increase of the parasympathetic activity. Hence, there is a regulatory disorder, but the regulation is not blocked. The green range in the background is defined as normal for a measurement at rest. A reduction of the sympathetic activity underneath this green range during the guided respiration is seen as a positive reaction. Afterwards, you can print or mail the measurement as a PDF file. You can send the measurements to your archive in order to have them saved to a patient's health record or within a practice software program. You can also contact support in case of any questions regarding the measurement results. Generally, you can expect to receive an answer within 24 hours. If you don't have access to a Wi-Fi connection, you can export the measurement via a USB cable to any computer. Usually, it is recommended that the patient receives the simplified layout, which includes a short explanation of the measurement. Optionally, you can also mail the patient the practitioner view results as well as the raw data. The previously entered email address will be used automatically to dispatch any measurement results. ANS Analysis. Ingeniously simple.